February, as you know, is Heart Month, and so we are so happy this morning to have Dr. Andrew Fowler from the Chattanooga Heart Institute at Memorial talking about something that honestly has affected especially Southerners, it seems, for an awful long time. Good to have you this morning.
Thanks, Julie. Good to be here.
You gave me a bit of an education already. We're talking specifically about plaque buildup in your heart. That's the coronary part of heart disease, right?
Right. I like to think of the heart in different compartments. You have electrical problems of the heart. Sometimes we'll remedy that with pacemakers and defibrillators. And we have valvular problems of the heart, and we have exciting new technology to replace heart valves. We have plumbing parts of the heart, which is what we're going to talk about today, where plaque can build up inside the arteries.
Okay, so this is something that has been a national campaign for a long time, and most of us who are midlife and up can look at how we try to approach our heart health now versus even 20 years ago.
Right.
Diet is a big part of that.
Big part of it, yeah. And I think leading up to this, we've talked about how this affects so many people. We all have family members, we have friends that have been affected by heart disease. And this month is Heart Health Month, and we want to raise awareness and we want to educate people as to what their risk is and what they can do about it. Diet is a big factor, and some things we can't control. Our genetics and what our parents give us is sort of out of our control, but we can make important lifestyle decisions to reduce our risk.
So for anyone watching today, maybe they're like me and heart disease runs in their family, what are some things to either add in to your diet or eliminate from?
Right, so you want to limit your red meat, you want to limit your fatty foods, you want to try to add in more salads, fruits, vegetables, things that you've always heard. Maybe eat oatmeal for breakfast instead of going through the McDonald's drive-thru. Okay,
which is something, as you say, empowering. Everybody can do it. Start with one thing and you begin to feel more and more in control.
I think, if you make one or two good decisions every day, that will really add up in the end.
Okay, so what about the symptoms of a plaque buildup? Because people need to know what to watch for.
Right, if you've read the textbook, you experience a heaviness or a tightness in the chest. Oftentimes it'll radiate up into the jaw or down the left arm. You can have shortness of breath, you can have nausea, you can have a pallor, kind of sweaty kind of feeling comes over you. And if you experience those things, you need to get to the emergency room right away.
A visual is helpful for me anyway. So what you're talking about is that these, quite honestly, bad choices that a lot of us make every day over time clogs up like a drain.
Right,
that artery.
And so you can think of plaque as, imagine if you punched a hole in your wall at your house, and spackle is the thing that comes over and kind of heals that hole. Well, cholesterol is sort of like that. It's a response to inflammation. Inflammation comes from smoking cigarettes, it comes from high blood sugar with diabetes, it comes from high blood cholesterol and high blood pressure. All of these things produce inflammation in the body, and the body's response to that is to lay down plaque inside the arteries. And it becomes a problem over the years when it continues to grow and eventually narrows the artery to a point where the blood can't get through.
Okay, so as a cardiologist, if somebody comes in and they have signs of this plaque buildup, depending on, I guess, their age and their overall health and the degree, what will you do first? Try some medication or lifestyle changes first?
Right, yeah, so all of that's very important. If we know that somebody has plaque in the arteries, we want them to be on a baby aspirin every day. That has been proven to reduce risk of heart attack and stroke. We also want to put them on cholesterol lowering agents like statin drugs like Lipitor, Zocor, Crestor. We want them to be making healthy lifestyle choices, exercising every day and avoiding the fatty foods that we talked about earlier.
If those, though, are not enough, that's when you go in surgically, and you brought something with you small enough to fit in your pocket.
Right, and so I've got a test tube here that has an actual coronary stent inside of it. And it looks like the spring on a ballpoint pen, but we can go inside the artery and we can open up the artery first with a balloon procedure called angioplasty. We take the balloon out, then we come back with a stent that stays inside the artery forever. The stent tacks the artery up, keeps the artery from closing back down, and maintains blood flow through the artery.
Prevention, I guess, is always your primary goal.
That's the goal.
So I was talking to you before we began the on-air part of our conversation about my family history with my dad dying young. And you said that there are some specific tests that people should ask for.
Right. I think the main thing is to make sure you're seen by your primary care doctor at least once a year. If you have that family history, make sure that you're having your cholesterol checked, your blood pressure checked, your blood sugar checked. Make sure that you get an EKG of your heart, which is a simple thing to do in the doctor's office. Your primary care doctor might refer you to a specialist, to a cardiologist for further testing, or sometimes they'll go ahead and ask you to run on a treadmill. They'll hook you up to an EKG machine as you run, and we can test to see if there's any markers for ischemia or changes on the treadmill that would prompt further testing.
And then when you turn 50, there's a test that you pay a minimal amount of money for.
Right, $50, you can go get something called a coronary calcium score. It's a great way to determine your risk stratification. You know, is your score 0, is your score 100, is your score 1,000? And that helps us decide if you do need further testing.
Memorial has such a great reputation for the team approach to its care and the excellence of care it provides, from the Mary Ellen Locher Breast Center to the Heart Institute. So when people come to you, y'all have 6 locations truly around the viewing area, not just Chattanooga proper.
Right, and so we're in Cleveland, we're in Ooltewah, we're in Hickson, we're downtown at the Glenwood campus. That's sort of the main hospital that we work at. For the heart catheterization procedures, we tend to do those there. We have some exciting new technology with valve replacement using a catheter that we do down at the main campus.
And so that team approach, I guess, still extends even within the Heart Institute, because where you specialize on the coronary side,
right.
If there's another problem you're seeing, you've got...
Right, so we have over 20 partners, and we have guys that specialize in the electrical side of the heart that implant the pacemakers and defibrillators, and we have the doctors that do the stent valve replacement, and then we have doctors such as myself that put the coronary stents in. Okay,
so in terms of making an appointment, many people I'm sure are thinking, okay, this is the day, I'm not going to wait any longer.
Right.
Can they self-refer?
They can, absolutely. We're always happy to see anybody who has any concerns or questions. We do that every day. You can call 697-2000. And you can get an appointment through that number.
So Dr. Fowler is usually at the Hickson location, but you do travel around. But that is the main number there. Call, let them know which of the 6 locations is closest to you, and they will help you from there.
That's right.
Thank you for the advice this morning.
Thanks, Julie.
We're back after this.